Alabama is one of many states reporting a significant surge now in these new COVID infections. Today, a Facebook post from one Alabama physician is getting a lot of attention after a report on Alabama.com. Dr. Brittany Cobia works at Grandview Medical Center in Birmingham. She wrote, quote, "I'm admitting young, healthy people to the hospital with very serious COVID infections. One of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and tell them that I'm sorry, but it's too late." Florida, of course, also facing a surge in new cases. Miami Herald reporting the rapid increase has some Florida hospitals limiting visitors and preparing again for the very worst. Here to help us is Dr. Eileen Marty, professor of infectious diseases at Florida International in Miami. In the past, she has worked on global medicine with the World Health Organization, among others. Doctor, I won't draw you into Florida politics, except to say that I'm guessing I join you in welcoming your governor, along with his first-class education from Yale and Harvard Law School, over to the side of vaccines. That having been established, tell us about the situation as you know it in the state of Florida tonight.
So in the state of Florida, even though there's a substantial percentage of people that have had one dose of vaccine, fully vaccinated people constitute about 51% of the population overall, and that's nowhere near the necessary herd immunity. And what we're seeing is a real rise in hospitalizations. Just over the last week, we've had another 45% increase in cases in hospital. And the bulk of those cases are people from age 20 to age 39, with more in their 20s than in their 30s. So this is very grave. It's absolutely affecting young people. We're even seeing it in children at higher rates than we ever did before. And while I have not had the experience of the physician from Alabama, my patients do say that they wish they had taken the vaccine, because virtually every single one of these people that we're hospitalizing, with rare exception, is someone who is unvaccinated.
Doctor, we're always so fortunate to spend some time with you. This is your life's work. You've worked all over the world. Did you ever dream that the anti-vax movement, that politics would make the vaccine effort so difficult in this country for us to get up to herd immunity?
Absolutely not. It boggles my mind when we all just step back and consider the advances in public health, the advances in medicine in the 20th and now the 21st century. It's incredible what we're able to do, thanks to primarily things like vaccines. Vaccines have eliminated so much suffering in the world and eradicated two diseases, smallpox and rinderpest, from this earth. They are, and the vaccines that we used years ago are nowhere near as effective and as safe as the ones we're using today, including the COVID-19 vaccines. It is unbelievable that there are people, especially here in the United States, where it's so easy now for anyone who wants to get a vaccine dose, that they wouldn't take something that is absolutely to their benefit, to the benefit of their families, to the benefit of our community, and to the benefit of our economy.
So glad you answered that question that way. And the final question is this. I ask it of every physician on this broadcast. For the vaccinated, what should be their level of concern about the Delta variant?
Yeah, that's a really serious issue. You have to do it individually. You have to look at whether or not that vaccinated person has any reason, any medication that they may be taking, or an age-related reason why they may not have that highest possible level of protection. For those individuals in particular, they have to absolutely be wearing masks in indoor spaces. And all of us, even if we are relatively young and healthy, I kind of think I'm still on the young end, if we're fully vaccinated, but we're going to have to be in an indoor space that's unventilated and crowded for a length of time, it's wise to go ahead and use a mask in that point. Because really, it's always best to layer your protections. This new variant is far more infectious. The infectious dose is less, which means you need less time exposed in order to get a high volume that's going to potentially overwhelm the protections you have. No single public health measure is 100%. Layer your protections when it's appropriate.